Have you ever wondered if something you've done your entire adult life, something that feels natural, private, and harmless, could suddenly become a health risk after 50? What if masturbation, which many believe is healthy, actually has hidden dangers for your prostate as you age? Or does it still protect you the way experts once claimed? Today, we're uncovering the real science behind masturbation after 50 and its impact on prostate health. The truth is, sexual health doesn't have an expiration date. Desire may change over time, but the human need for intimacy and pleasure doesn't just vanish when you hit 50 or 60. In fact, many men find that masturbation becomes a more common part of their lives as they age, especially if they're single, widowed, or living apart from a partner. But here's the question: does this habit help your prostate, or can it hurt it? For years, we've heard claims that regular ejaculation helps prevent prostate problems. The theory is that ejaculation clears out old fluids and toxins from the prostate, reducing the risk of infections and even lowering cancer risk. Some studies have backed this up, suggesting that men who ejaculate more frequently have a slightly lower risk of prostate cancer later in life. That sounds like great news, right? But here's where science gets complicated. Frequency matters, age matters, and your overall health matters even more. Let's start with the potential benefits. When you masturbate or have sex, the prostate contracts, squeezing out fluid. This can prevent buildup of stagnant secretions that could harbor bacteria, which in theory lowers the chance of prostatitis or infection. Ejaculation also triggers a release of feel-good hormones like dopamine and oxytocin, which can relieve stress and improve sleep, two things that matter a lot after 50. And for some men, masturbation helps maintain erectile function because it keeps blood flowing to the pelvic region, reducing stiffness and improving vascular health. But here's the other side of the story, the part most men don't think about. After 50, the prostate is no longer the same as it was in your 30s. This is the age when benign prostatic hyperplasia, or BPH, becomes common. BPH means the prostate gland is enlarging, and it can press against the urethra, making urination harder. If you already have BPH, frequent ejaculation might temporarily worsen urinary symptoms because sexual arousal and orgasm cause the prostate to swell even more before returning to normal size. That extra pressure can make it harder to empty your bladder and might lead to discomfort. Another issue is prostate irritation. When masturbation becomes too frequent, especially daily or multiple times a day, it can cause low-grade inflammation inside the gland. This can lead to chronic pelvic pain, painful ejaculation, or that lingering discomfort you can't quite explain. Doctors call this chronic prostatitis or chronic pelvic pain syndrome, and it's much more common than people think, especially among men who overstimulate their pelvic region regularly without giving it time to recover. And then there's the question of energy and hormones. Every orgasm triggers the release of prolactin, a hormone that helps you relax but also suppresses dopamine and can influence testosterone. In younger men, this isn't a big deal because hormone levels rebound quickly. But after 50, when testosterone is already declining, too much sexual activity can leave you feeling tired, unmotivated, and even affect muscle strength over time. Some men notice that excessive masturbation leaves them feeling drained rather than refreshed. If that's happening to you, it's a sign to slow down. Now, what about the cancer question? This is where most of the confusion comes from. Yes, some studies suggest frequent ejaculation, like 21 times a month or more, might lower the risk of prostate cancer in younger men. But here's the catch. These studies mostly looked at men in their 20s, 30 seconds, and 40 seconds. There's no strong evidence that daily ejaculation after 50 offers the same protection. In fact, some experts argue that after a certain age, chronic irritation from too much sexual activity could theoretically do more harm than good by creating an inflammatory environment in the gland. Does that mean masturbation causes cancer? No, but it does mean the protective effect isn't guaranteed in older men. So where does that leave us? The answer is balance. Masturbation after 50 is not inherently bad for your prostate. In moderation, it can help keep fluids moving, relieve stress, and support mental health. But when it becomes excessive every day without a break, or multiple times a day, it can increase the risk of irritation, worsen urinary symptoms, and contribute to fatigue. Here are some practical tips if you want to maintain this habit safely. First, listen to your body. If you feel pain, burning, or pelvic discomfort, it's time to slow down. Ignoring these signs can turn a small problem into a chronic one. Second, use proper lubrication to avoid friction that can irritate the urethra or surrounding tissues. Third, stay hydrated and active. Sitting for long hours can restrict blood flow to the pelvic area, making inflammation worse. Fourth, if you have BPH or prostate symptoms, talk to your doctor. There may be treatments to help relieve pressure so you can enjoy a healthy sex life without making things worse. And finally, don't rely on masturbation as your only source of pleasure or stress relief. Combine it with healthy activities, exercise, social connection, hobbies so your life feels full and balanced. Another important point, avoid comparing yourself to younger men or online advice that says you need to ejaculate every day for prostate health. That's a myth when you're over 50. Your body has different needs now, and the best approach is moderation. Now, let's address something men rarely admit: emotional health. Many older men use masturbation to cope with loneliness, boredom, or anxiety. While that's understandable, relying on it as your main source of comfort can lead to isolation. The happiest men after 50 are those who stay socially engaged, pursue meaningful activities, and keep intimacy as just one part of a healthy lifestyle, not the center of it. So, does masturbation after 50 protect or damage your prostate? The truth is it can do both, depending on how often and how consciously you do it. Occasional ejaculation is natural and even beneficial, but overdoing it, especially with an aging prostate, can lead to irritation, urinary issues, and fatigue. Your best strategy is simple: balance, awareness, and regular health checkups. Remember, the prostate is small, but its impact on your life is huge. Treat it with care. If you found this information helpful, give this video a like and subscribe for more practical tips on men's health after 50. Your body deserves the best care at every age, and knowledge is your greatest tool.